Hey, we're back with Dr. Bilski, and it's weird, Dr. Bilski. I want to hear about some of the things you guys got going on because I know you have stuff going on, but I hear you're into facial aesthetics. Facial aesthetics? Mm-hmm. Am I even saying it right?
Yes, you pronounce it properly.
Okay, what is that, and that caught my eye.
Yeah, so the term facial aesthetics it could mean a lot of things. Wrinkles in your face, deep furrowed grooves, washboard forehead, the 11s that most people are
the 11s, this
aware. Yeah, it's right down here.
Gotcha,
furrowed brow, you start seeing that. And that occurs as we get older, all right? And our muscles are contracting and we see all these lines. Facial aesthetics would also be skincare. Like, do I have acne? Do I have age spots, which are also called dark spots?
Okay.
I get these little veins in my nose. Can you get rid of those? I have this mole that I don't care for. Can you do anything about that? I have these new veneers that I've done, but it looks like my lips are real thin. Is there anything that we can do that we don't have to inject a chemical? So, of course we do. That's the facial aesthetics part. So, at my practice, Bilski Dental, what we're trying to do is bring everything under one roof that has to do with facial aesthetics and your smile.
That's pretty neat.
Yeah, so it's called Aesthetics with Bilski Dental.
Aesthetics.
Yeah.
And that's a separate thing you're beginning to offer right now. Well, separate, but it's kind of part of...
It's part of what
your smile, your lips, your look, and everything.
Right, it's part of what we do. And we're getting into it because we're finding out that there's a need for it.
Yeah.
And people would like to do better. I think the pandemic helped with Zoom. And on Zoom, most of the lady friends that I know, they have to have their hair and makeup done properly.
Just to get, before we have that meeting,
And they have to make sure their teeth are looking good, of course. And so there's a lot in consideration of how we present ourselves.
Well, let me ask you, because I would think, okay, somebody's going to take care of the wrinkles. I would think plastic surgeon. So why dentist? Why would I go to a dentist?
All right. So I think we had this conversation once before, and I hope my buddies are listening because the movie Hangover, if you remember, the dentist says, "Hey, can I look at that record of my buddy?" And there's like, "You're not you're a dentist. You're not a doctor."
You're not a doctor.
So that's been the joke. So the statistical data, you can look this up and reference it.
Yeah.
There's about 6,000 plastic surgeons in the United States. There's 250,000 dentists. All right. About 25 or 10% of us in dentistry do these facial things: Botox, dermal fillers, microneedling, lasering, facial peels.
You've sort of been doing this stuff.
Yeah,
people maybe just don't realize it.
Yeah, so we've been doing it for a while, and we use Botox and a lot of other things, TMJ, migraine headaches. Yeah. The reason why dentistry is probably better set up for this is because certainly a plastic surgeon is very well trained in these procedures, facial aesthetics.
Sure.
However, they're doing procedures like breast and butt augmentations, liposuction, facelifts, and all the other bodies.
They're doing some really heavy sort of lifting, so to speak.
And they don't have time to take on these less or hardly invasive procedures like microneedling, like removing age spots or tightening skin with lasers and or microneedling. So our training as dentists primarily is head, neck, face, and of course the oral cavity. So that's where our focus is.
Halfway there anyway.
Everything above the clavicle. So not that you can't go to a plastic surgeon for these procedures. And dentists are as good in these cases to take care of these smaller procedures, less invasive, that don't take as much time. And our offices are already set up for chairs that you sit down. We can take a look. We do photography.
Yeah, right.
We talk about what you want. Maybe you have acne scarring and we want to get rid of the acne scarring. Okay, well, once you sit down, we'll take some photos and we'll look at all the views. We have corrected lighting, so all the photos are the same all the time. And we can compare it, and after 3 treatments, we're seeing great results with the acne scarring removal.
That's pretty neat.
Fine lines being reduced.
It's pretty neat.
Nasolabial folds that are gone, the little marionette lines, the 11s, and we can do this without injecting.
That's pretty neat.
So people kind of like that.
I bet.
You don't have to stick a needle in anybody's face. you might be interested in at least listening to us. So.
Well, it'd be worth doing that, and so somebody can come in and let's say even a client you have right now while they're getting the teeth, and they say, hey, Dr. Bilski, I love my teeth, but yeah, my lips are kind of messed up. I want to.
Well, so the analogy that we use is let's use the smile. The smile is nice. The teeth are done. They're perfect. They may have orthodontic treatment. They may have had whitening. They may have had veneers. But they're just something that's just not doing it. And when we really analyze it, and I try to be as respectful of someone's, how they feel about themselves, but when they bring it up, my next question to answer their question would be, well, your smile is beautiful. If we did the work, of course, we feel it's good and adequate. Or if you had it done elsewhere, like, God, your smile's great. Why? What's the problem? I don't know, like my skin around my mouth, my lips are thin. And so, well, would you mind if we tell you about what we could do for you here in this practice? That we could use lasers, we could use microneedling. What's all that mean? Well, it's, non-invasive things that could be taken care of in the comfort of this office. You have an anonymous type of treatment here until you feel comfortable with what we're doing. And some of these things like you're talking about, like you love your veneers, but you feel like you have a thinner upper lip. Well, with our lasers, in about 2 or 3 treatments, we can get you plumped up as if you had some fillers.
You just mentioned something too that's kind of interesting. It's the anonymous. I mean, because some people are like, well, I don't want to know somebody. I went to somebody about my eyes, or they just say you went to the dentist because that's what you did.
Exactly. So, and I always use Randy. If Randy was coming in, he wanted his lips plumped up. And Heather, who he works with, said, "Hey, Randy, can I see you this afternoon?" I'm like, "Oh yeah, I have a dental appointment today."
That's right, exactly. That's
and Heather, as a friend of his, would say, "Oh, what's going on? You got a toothache?" No, it's just a little Novocaine procedure, doing some laser stuff. So my lips are going to be kind of numb a little bit, and she's going to say, "Oh, are you going to get injections?" Oh, no. They just put this cream on. They hit it with the laser.
I think this is a whole nother reason. I mean.
And then when you're comfortable, 3 months later, and Heather's, geez, Randy.
Well, you look younger for some reason.
Yeah, what have you been doing? And so, well, remember you wanted me to come in at 2 o'clock?
Yeah, right.
I had to go see Dr. Bilski.
It was Dr. Bilski.
Yeah, he did this laser stuff,
I'd say that's really neat. It's a great offering. Now, what are you calling this again?
So, Bilski Dental and Care Aesthetics.
Care Aesthetics
are combining together, and Care Aesthetics is just an organization of dentists that do facial cosmetic procedures, non-invasive. So we're blending them together. So when you come in for an appointment,
it's really neat.
First time, or even if you're an existing patient, we're looking at things a little differently. Hey, your teeth look great. Is there anything else that you're concerned about?
That's neat.
No. Well, doctor, what's this Care Aesthetics that I see all over the place? Okay, since you asked, do you mind if I give you a little education on what we're trying to do, like what we're doing here?
Pretty neat.
So, hey, I'm just trying to blend facial aesthetics or cosmetics along with dental aesthetics, dental cosmetics. And if this is something that makes sense to you, this is what we provide.
It's very neat.
If you're interested, let's talk about it.
Is there more information on your website or anything?
Yeah, there is. There is. Actually, the best way to do is just go on our website, see what's out there, come out, or click the box and schedule a no obligation free consultation.
Yep.
And then when you come on in, we have this book that we give out. It's called Care Aesthetics, and it has all the procedures of facial cosmetics.
And what's really neat, I saw in this book, there are little QR codes. You can just point your phone at it, hit it, and you're going to actually see everything that happens for that procedure.
So how that helps me when you're coming in, say, and Randy's skin's fine, but say he had an acne scarring problem, or he's active in acne, particularly the high school kids.
Yeah.
We get this a lot from the moms and the dads, like, my daughter, she's having her pictures taken. She's a junior. She's really concerned about her skin. Is there anything that we can do? Because I see you have all this stuff with facial aesthetics. And say, hey, you know what? Why don't you just take this home, give this to your daughter, or give this to your son.
That's great.
And look at it. So in other words, they look, they see the QR codes. Now they're educated on how the procedures are performed. They're non-invasive. They do not hurt. There are no side effects from any of this. what is it exactly now that you want me to talk about? And it usually is, when can I get started? How much does it cost? How long will it take? Those are always the 3 questions. And it's just a nice educational piece that we like to offer. So I would rather spend the 20 or 30 minutes explaining what you want versus trying to have me tell you as I analyze your face. Like, maybe you're fine. Maybe you have a dark spot on your face, but that's been you all your life.
Right.
And for me to say, hey, would you like that dark spot removed?
How dare you? That's my thing. You know?
Exactly. And as a dentist, the other thing is too, you've seen people with a gap in their teeth. That's called a diastema. So my question is like, hey, is there anything about your smile that you do not like? Like, are you concerned about any gaps that you have in your teeth or any crowding? So I'm hitting it on both sides, hopefully not offending anybody. But if you remember who Michael Strahan is.
Yes, I sure do.
So like, he has an excessive gap, and doctors, dentists write to him all the time. And he's like, forget it, guys.
That's his thing. I mean, that's Michael Strahan. Exactly, man.
Yeah, I'm not taking care of it. It's fine. And I agree with him.
Yeah, it's his thing.
That's Michael Strahan. Yeah,
I got to let it go. So, well, hey, that's pretty exciting stuff, Dr. Bilski. And I think it's gonna, it's really convenient to get more than just your teeth done if you want. Yeah. So all you have to do, if you're not already there, head to the website, bilskidental.com, and check it out. I think you're going to like what you see.
Yeah.
Thanks.
Thank you.